I'd like to share some of my philosophy on patient care. I am very fortunate to be able to help people, and pretty much every physician would say that. It really is a wonderful calling. And when I'm with a patient, my desire is to do everything I can first to understand what the patient is experiencing. After that, I do everything I can to figure out what is causing the problem that the patient brings to me. Then I do what I can to figure out what can be done to help that problem. The next step is to help the patient understand what are the options, what I'm thinking, why I'm thinking this, what I'm thinking could be causing the trouble, what we could do about it, both non-surgical and surgical, if sometimes surgery is appropriate. And then I help the patient make a decision, and I help the patient do what he or she wants to do with their body. My focus is when a patient comes to me, at that moment, they are my boss. They have hired me to help them figure out what's wrong and help them do what they need to do to correct what's wrong or live with what's wrong. It is not my desire or to tell them what to do with their bodies or to tell them how to live their lives. My focus is to help them get a better quality life. Sometimes that's with surgery. Most of the time, actually, it's not. What I expect of a patient is someone who's going to be honest and open with me, who will think about the questions I ask. I actually ask very simple questions, but a lot of them. Like, where do you hurt? If they have neck pain, I hurt right here. As opposed to, well, yeah, I've hurt ever since I turned my neck when I was going to the mailbox. You know, where do you hurt? Where does the pain go? When we talk about pain, there are numerous things we have to ask. The location, the character, the radiation, like does the pain go places? Yes, it goes down to my left arm or it goes down to my leg. Associated symptoms, numbness, tingling, weakness, bowel or bladder dysfunction. When it started, is it getting better? Is it getting worse? And then other things like what exacerbates it, like what makes it worse? Walking makes my pain worse, or sitting makes my pain worse. I feel terrible when I'm lying, or I feel great when I'm lying. How far can you walk? I can't walk more than 100 feet before my legs give out, things like that. And then what have you done? I've tried therapy, or I've tried anti-inflammatories, I've tried muscle relaxers, I've tried chiropractic, or I've had steroid injections. All those things are very, very, very important to me. And the reason why they're important to me is if I don't understand what a person feels, what brought it on, what makes it better, what makes it worse, and what they've done, I have no hope of figuring out what's wrong or giving them any reasonable advice about what they could do. So I actually ask all those questions with every patient that presents to me.